Well, on this Wellness Wednesday, we are talking about breast health and the confusion around mammograms this morning. So I'm going to look at these numbers. A survey from the Ohio State University Comprehensive Cancer Center recently revealed nearly half of women still incorrectly believe that mammograms should start at age 50. But for more than a decade, the recommendation is that women start getting mammograms at the age of 40. This has helped cut breast cancer deaths by more than 40%. Dr. Kinney is here with us this morning, and we're going to talk about the facts. To clear this up, what is the recommended age to start getting a mammogram, and walk us through the expectations and the exceptions?
I still recommend getting mammograms at age 40 in keeping with the American Cancer Society and the American Society of Breast Surgeon recommendations. There are some recommendations and changes that can be individualized for each patient. But again, catching cancer early is going to always make the difference in how easy it is to treat it.
And why do you recommend doing them yearly?
So breast cancers, fortunately, typically grow on the months and years time frame. However, each time we can catch it early, again, you can minimize the treatments, hopefully avoid that chemotherapy, hopefully avoid radiation.
Now, what are you looking at, and what should patients be looking at when they determine what's right for them? How often, when, that sort of thing they should go?
Sure. So it depends on the women's risk level. So again, most of these recommendations are based on an average risk patient. So I encourage everyone to have a conversation with their doctor. Are they actually average risk? You know, do you have dense breasts? Do you have strong family history? Are you on hormone replacement? All of these things can change your risk factors and may require more frequent imaging.
What are your 3 big tips that you want to share to just clear up any confusion today?
Of course. So know your risk. Are you average risk? Are you high risk? I do encourage you starting mammograms at age 40 and do continue them yearly, because the earlier we can catch it, the easier to treat. And of course, keep doing your mammograms. There's no reason to stop if you're still healthy. Some of the recommendations say you could stop at 74, but I disagree with that. As long as you can still walk to the mammogram place, you should keep going.
And you mentioned dense breast tissue. How do you find that out, and where do you go from there?
So you can talk with your radiologist when you go for your screening mammogram, but it's also written on the report, and you can see which level density you're at. If you're more dense, you may require additional screening ultrasounds or even MRI screening for those extremely dense women.
All right, that's good to know. Thank you for the clarification and the information. Thank you, Dr. Melissa McKinney. We appreciate it.
Thank you.
All right, so that's from Dr. Kinney, and right now we're going to take a quick break. We'll have more Plus on the other side of this.